guys, this is Sharon. We're going to do a little bit of fall prevention today. Remember, fall prevention is about strength. It is not standing on one foot, right? That really does nothing to improve your balance. So remember, do your best, do what you can, and try to follow along. You're going to need a chair. So I have one right here, so let me just grab it. Get a little closer to you. And we're going to start by testing things out. So, seated upright in the chair, going to have both feet flat on the floor. Now you're going to rest your back against the chair. And this is what we're going to do first. Holding on to the base of the chair, you're going to bring up that left knee, and I want you to try and hold it for a count of 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, keep trying, that's it, 6, 5, 4, 3, 2, and 1. How did you do? Little tough, isn't it? That is what is called a static hold. Generally speaking, it is more difficult for a muscle to hold one position than to have the muscle complex in dynamic motion. Okay, we've got two legs. Let's go over to the other side. Bringing up the opposite leg, knee rather, holding it for a count of 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Woo! So ironically, that was a balance exercise. Why? Very briefly, when you lose your balance and you need to arrest your movement, that is, stop your movement as you're in motion, right? You're going to use the muscle, in part, the muscle complexes that you just exercised, specifically the TFL tensor fasciae latae complex. Let's keep going. If you can, I'm going to have you stand up in front of your chair. Make sure that chair is behind you. And we're going to do some sit to stand with a little kick. I'm going to have you to bring both feet up in front of you. Because this is one of the first classes, I'm going to go easy on you. Let's just do 25. Remember, stop if you need to. Make sure that chair is there. Crossing your arms over your chest. Remember, any knee pain, please stop. Sit. Kick the feet up. And up. 25. Oh, good. 24. Kicking the legs out. 23. 22. I know you love it out there. 21. Excellent. And 20. And 19. Notice how your legs feel. 18. What muscles are being activated? 17. Try to stand all the way up. All the way up. 16. Good. And 15. Pushing up through the heels. 14. Good. 13. Perfect. 12. 11. 10. Remember, stop if you need to. 9. And 8. You will get stronger as you go along. 7. Good. And 6. Kicking both legs out. And 5. Good, good, good. 4. Perfect. 3. I see you all out there. I see you. 2. Good. And 1. Wow. 25 is a lot. Not really. So that exercise only took about a minute or so to do. So why is this exercise also part of balance? Well, when I had you kick your legs out, I had you to disengage the muscles, right, from the floor. This incites a very specific reflex that aids in balance. We're not going to get too technical for the purposes of this program, But just know that kicking the legs out and standing up is more difficult, not only physiologically, but neurologically, than to keep your feet on the floor the entire time. Let's come to a little bit of upper body now. Now, I know you're saying to yourself, well, how does upper body help me with balance? Easy. Upper body strength allows you to create drag. Drag can be as simple as when you're putting on your shoe, you lean on the chair so you can balance yourself. When you fall or stumble and you need to grab an object, the ability to dissipate the stress of that forward momentum into your upper body, what happens? It helps you, it gives you time or chance to get your legs under you and or decrease the amount of force that would otherwise go against your head or another part of your body. So upper body strength, actually global strength, all of your strength, all of this is confluent in balance. So again, balance isn't about standing on one foot. It is having the strength to control your movements while in dynamic motion. All right, for this next exercise, we're going to stay seated as well. Going to sit with your back off the chair, nice and straight up. I see you out there, no cheating. I can see everybody. Going to have your knees and feet together. This one's going to be so easy. You're going to have your palms facing the ceiling as much as you can. You're going to bring that chest up. This is the side view. You're going to bring that chest up a little bit. If you have shoulder impingement or rotator cuff difficulties, do not push through this exercise. Real quick, modification if you have any type of shoulder issues, do this instead. Okay, we're going to go for one count of 40. I know you can do it. 40, elbows down. 39, elbows all the way down. 38, good. 37, 36, 35, 34, good. 33, 32, 31, and 30. You're breathing, good. 28, 27, 26, 25, 24, 23, breathing, 22, 21, 20, 19, notice where you feel the burn, 17, 16, 15, those are the primary muscles fatiguing, 13, 12, 11, good, 10, 9, 8, 7, good, 6, 5, just do what you can, 3, 2, and this is the hard part, bringing your arms up, holding it there for a count of 20, 19, 18, 17, 16, just try, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Keep it right there, palms facing down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Where did you feel that? Front part of the shoulder, anterior deltoid. The anterior delt, this portion of the shoulder, allows you to push yourself in the frontal plane. So, for example, if you stumbled forward and you needed to grab the chair, the action of pushing yourself up would be a function of the muscle complex you just exercised. And I apologize, it's a little bright in here. I will do better next time. Okay, you know what? I'm going to move my chair right over here. All righty. Is that a little better? Let's see. I may have to edit that. That's okay. Okay, we're going to come back to lower body. Again, this exercise is going to be in the chair, Again, standing on one leg is just a test to see how your strength is coming along, how strong you are. For this next exercise, we're going to work on the interior or medial aspect of the thigh. So again, you're going to sit, back against the chair, move up a little bit. Now what I want you to do, you're going to bring that leg out to the side there, holding on to the base of the chair. We're going to go for one count of 35, crossing the leg over and bringing the entire sole of the foot to out that left leg. We're going to cross over 35 times. 34, 33, 32, 31. The entire foot on the floor. Good. This is 29, 28, 27, 26, 25, 24. Notice where you feel it. 22, 21, 20, 19. Good. 18, 17. Uh-oh, I see you out there. I see you don't like this exercise, do you? I know. 14, 13. Good. 12. You're breathing, right? 11, 10. Good. 9, 8, 7. Good. 6. It should be getting a little tight. 4, 3, 2, and 1. Excellent. Internal rotation facilitated in part by the adductor complex. What do the adductors do? Well, the adductors help you to step over things. That movement right there. So, not only do you work the adductors with this exercise, we're also targeting ever important hip flexors. When your hip flexors get weaker, right, you're no longer able to bring the leg up as you walk, right? You will begin to shuffle because the muscles don't have the strength to give you length of gait. So it follows. When the hip flexors become weak or not as strong as they were, like I said, shuffling follows. Once shuffling follows, this opens the door to loss of balance and perhaps more importantly, the inability to self-correct if you do stumble. Remember, we all slip and stumble. It happens to everyone. But it's the ability to recover is where the difference is. Let's go over to the opposite side now. So for me, this is my left, so it might be your right because I'm opposite of you. We're going to keep it equal. So we're going to go for 35 on that leg. Remember, foot flat on the floor. And please, I see you out there. Don't do that. Oh my goodness, that just defeats the purpose. It's okay if you can't cross your leg over. It's even okay if you can't bring your leg all the way in. Just try. But don't help that leg if you can. 35, foot flat on the floor. 34, 33, good. 32, 31, perfect. 30, 29, 28, 27, 26, 25, 24, 23, 22, breathing, 21, and 20, 19, 18, 17, 16, 15, 14, 13, 12, breathing, last 10, and 9, and 8, 7, 6, 5, 4, good, 3, should be burning just a little bit, and 1. Bringing that foot to rest on the floor, inhaling through the nose, exhaling through the mouth. And before we go any further, remember, please stay safe, stay home. If you absolutely have to go out, please remember to wear a mask. wash your hands, and if you do feel ill, call your physician to get proper guidance. Okay, you should have gotten a little bit of a rest there. All righty, we're going to come back to upper body. Now we're going to work the back of the shoulder. So in the first exercises that we did, we worked the front of the shoulder. Now we're going to work the back of the shoulder. Weakness in the back of the shoulder is a huge reason for rotator cuff injuries. It just happens. So by increasing the strength of the back of the shoulder, we help your rotator cuff stay nice and healthy. So this is an exercise, again, done in the chair, and it's pretty simple. This is horizontal abduction with pronation. But in layman's terms, you're going to bring the backs of the hands together like this. Remember, any acute pain in the shoulder area, you can default to this exercise instead, but never work through pain. With the backs of the hands together, let's go for a nice round number of 40. 40. Notice my hand position. The backs of the hands stay facing each other, so to speak, or the thumbs are pointed downward. 38. 37. I'm going to turn so that you can see my side view. 36. 35. And don't force your range. 33. Whatever you can do, it's okay. 31. 30. Try to keep the arms 29 parallel to the floor. Try not to let them drop, okay? 27. 26, and try not to go too quickly. 25. 24. What your brain does is try to speed you up when the movement is too hard. 22. 21. And 20. Notice where you feel it. 19. Rear delta is being activated. And this is 17. Try to keep the chest up. 16. Feet flat on the floor. And 13. Breathing. 12. You can do it. 11. This is for balance. 10. And 9. 8. Breathing. 7. 6. Perfect. 5. 4. Good. 3. It's okay if it's burning. 2. It'll go away in a moment. 1. And relax. So the muscle activation, the burn, you should have felt right through there. Little tip, because I love to give tips when I teach, when I instruct. It's what I'm known for. If you or a loved one has a job where you're packing boxes, maybe you work at the post office, you do a lot of work in front of you like that. One of the ways to offset 8 or 10 hours of working in front of you like that, the frontal plane, is to do an exercise like this so that you compensate for all of that action on the front of the delt by activating the back of the shoulder. This will help keep your shoulder nicely seated in the socket. Whenever you do a lot of work on the shoulder in one area, it can move the bulb of the humerus, right? It can move it a little bit. There is not a lot of space in what's called the glenohumeral joint, the shoulder socket, right? That joint. There's not a lot of room in there. So when you partake in an activity that overactivates one part of the shoulder, even with a slight shift of that humeral head can cause enormous pain. So remember, if you do a lot of manual labor, construction, painting, anything like that, before you go to bed, do about 40 of these a night. Your shoulder will love you for it. All righty. Now we're going to do some fun stuff. Isn't this great? We're going to come back to the legs. So for those of you who are watching who have issues with standing, I'm going to give you an alternative exercise right now. What you're going to do, you're going to come back to one of our earlier exercises, and you're going to bring one knee up, and one knee down. That is going to be the alternative exercise if you cannot stand. However, if you can stand, come along to the back of the chair. So we're going to come around here. And now we're going to work a little bit on the back of the leg. The back of, I'm going to stand right here so I block that light. There we go. So the back of the leg, the glute, and the hamstring work in concert together to propel you forward. So when you walk, right? When you walk, first you strike down with the heel. This is where the quadricep is activated. As you shift your weight and push off, actually for purposes of this explanation, we're going to stay focused on the right leg. When you push off, this action activates the glute and hamstring. When the glute and hamstring, the back portion of your leg, is not as strong as it could be, the stress remains on the front part of the leg and where else? Your knees. So keeping the back of the leg activated is one of the go-tos when you've had knee replacement surgery or you need physical therapy for torn meniscus, ACL, all of these things. Because the strength of the back of your leg helps to take stress off the knee. Okay, we're going to come back to this frontal view right here. And you're going to have your knees and feet apart, just like that, holding on to the chair. Now, what I want you to do now, I have to turn around again so you can see me. I want you to stick your bum out. That's it. Toes are pointed outward. You're going to stick your bum out. And I don't want this stuff. No, verbatim. You're going to keep that bum out. You're going to keep it out. And you're going to try to kind of keep the bum back and then push up through your, oh, isn't that easy? I know you'll love this exercise too. We're going to go for one count of 25. Remember, if it's too much for you, you go to that alternate exercise that I described earlier. Knees and feet apart, watch that knee pain, any acute knee pain, please stop. 25, driving up through the heel, not too quickly. I see you rushing out there. Don't rush. We've got plenty of time. 23. 22. So you want to sit back in it, right? 21. But don't topple over. Okay, and 20. Good. And 19. Pushing up through the heels. And 18. 17. Wonderful. 16. And 15. 14. Driving up through the heels. 13. There you go. And 12. And 11. Good, good, good. 10. 9. Excellent. 8. 7. Perfect. 6. 5. Good. 4. 3. 2. And 1. Woo, shake those legs out. Okay, so now we're going to do a little bit of testing. This portion is we're going to test one balance position on each foot. So if you've been sitting and you feel comfortable, I'm going to ask that you stand behind your chair. So I'm going to bring the chair this way that you can see. Okay, so you've just done a little bit of prep work, priming those muscles. Now, again, we're going to do a little bit of balance. What I want you to focus on is relaxation. Many times I have observed people practicing balance. They have this look of terror on their face, sheer terror. It's like they're trying not to move. No, that's not what balance is about. Think about when you watch dancing. There's a great show called Dancing with the Stars, right? Part of what they are graded on is what? Fluidity of movement. I want you to think about balance more so as a dance against gravity or with gravity. So standing behind the chair, we're going to do this nice and easy. You're going to separate both feet, about a foot or so, about a foot. You're going to bend both knees. So you're bending your knees. Try not to bring the knees in. I want you to keep your chair in front of you. I'm going to move mine so that you can see what I'm doing, okay? But I want you to keep that chair in front of you. So imagine the chair is in front of me, right? And you have that bum, right? So this is the position, the side position. Not that. This is very bad for the knees. You keep that bum back. Now what I want you to do, holding on to the chair, I want you to roll up, just bring your heels just an inch off the floor so you feel your quads activate. Okay, I'm bringing the chair back. All right, so we have our hands on the chair. Your heels are off the floor just an inch, not too high. Now what I want you to do, I just want you to flatten your hands over the chair so the chair is right there so you can grab it. You're going to feel those quads start to burn a little bit. We're going to hold it for a count of 20, 19, 18, 17, 16. Breathe, breathe. 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2. Heels down. Excellent. Wonderful. So what you're doing there, as I mentioned in the beginning of class, is teaching your muscles to engage with strength, to control your movement. Remember, I was mentioning in one of the previous exercises, when you're not as strong as you could be, your brain is going to speed up the movement. So let's say you need to step over an object. The brain says, oh gosh, I don't know if we can handle this. So it's going to rush in and jump over the chair. Real strength is the ability to move slowly. The slower you can move, the stronger you need to be. Ironically, you would think that if you move faster, that you would be stronger. No. When you move faster, you don't need as much strength. Further, you open yourself up to injury because you decrease the amount of time that you have to react in case you lose your balance. So if you're moving slowly over an object and you stumble, you got plenty of time to self-correct because you're not near the floor. You're not falling that fast. But if you're moving quickly, your momentum has you going at a faster rate, less time to react. It's just like if you're driving a car. If you're driving a car at 5 miles per hour and you see another car coming across, you've got plenty of time. You can stop, right? If you were going 100 miles an hour and a car was coming out, less time to react. Okay, that's enough of a rest. We're going to do one more count of 25 because I care about you that much. All right, standing behind the chair, assume the position, toes and feet on the diagonal, stick that bum out. Want to keep the stress off of those knees. Holding on to the chair, dropping down into a squat position, bringing the heels just an inch off the floor. You're going to stay on the balls of your feet for this one. Ready? 25, 24, 23, 22, 21, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Oh, I stuck in an extra 5 count. Did you notice? Oh, you'll be fine. Okay, let's take a seat. This is the fun part of the exercise class now. Speed work. Oh, this is the most fun. So part of the ability to balance is the ability to move quickly. So for those of you who have children or grandchildren, or maybe you remember playing sports yourself, All sports involve speed work. Now, the type of speed work will vary according to the sport, of course, but speed work is important because this facilitates, again, fluidity of movement. The ability to move quickly and fluidly will also correlate to your ability to self-correct if you were to lose your balance. So seated upright in the chair. Now, everyone should be able to do this. Again, if you have any knee pain, you're going to default to this exercise instead. Okay, so what we're going to do is this. You're going to lean forward a little bit. Oh, this is fun. For a count of 25, 24, 23. It's okay if you're messing up. Have fun with it. 20, 19. Keep them moving. Keep them moving. 17, 16. Out and in. Good. 14, 13, 12, 11, 10. Try to speed it up. 8. Good. 7, 6, 5, 4, 3, 2, 1. Excellent. Inhale through the nose, exhale through the mouth. We're going to come back to that, but let's do a little bit of external rotation. This is also an exercise you can do if you are a loved one, once again. Work at a job or do manual labor where you do a lot of lifting, shoveling, painting, any of that. So this is our backward arm circle. Don't worry about your range. Just do what you can. I'm going to show you the side view. Seated upright, bringing the arms up, and with relaxed hands, bringing them back around. So from the front, it's going to look like this. Again, no forcing. Even if you can only make a circle like this, that's all you do to start. As you become more flexible, your body will allow you greater range of movement. But when you do exercises like stretching, or flexibility training, doing it gradually is the key. Muscles do not like to be forced to stretch. And tendons and ligaments are not designed to be stretched. So if you stretch, if you attempt a greater range of stretching too quickly, you can potentially injure a ligament or a tendon. Nice and easy. Let's just do 10 more of these because I lost count when I was talking to you. And 9 and 8. Relaxing the chest. And 7 and 6. Breathing. Inhaling as you breathe. Good. Coming up on 4. Good, good. And 3, 2, one more exercise for this module. And 1, relaxing. Good. So this exercise, I like to explain. This area through here, the upper part of your chest leading into your shoulder, is part of the pec major complex. We often forget about it because we really don't use it for too much, right? It's just there, you know? But when this area gets tight, oh, it wreaks havoc. It causes the shoulder to protract forward. So an exercise such as this can in part be a guard against a hunchback. Inevitably, when you see an individual who has kyphotic posturing, this area will be very, very tight. You can tell if your upper pec is tight very simply. You take your 3 fingers and kind of push it in right next to your shoulder. If it really, really hurts, you've got some flexibility training to do. Now, one side may be more kind of painful than the other, which is normal. So if you feel like right where the muscle meets the shoulder, kind of get right into like that kind of notch in your shoulder there. Ooh, and you feel like it's really tight. That's not good. So exercises like this are great for that. Okay, we're going to come back to that speed drill, and then we're going to finish up this module. Now, the last speed drill we did what? Out and in, right? Okay. Now we're going to do it longitudinally. So for this, you're going to sit straight up in the chair, leaning forward again. Again, do your best. You're going to tap the feet forward and back. Neurologically, this is more difficult for the brain. So your brain is going to have you do this. Don't worry about it. Just go with it. Your brain is just a little angry with you, and your brain wants to make it a little easy. So hands on the chair. You first start by tapping. So the brain gets used to this. Forward and back. One count of 25. 24, good, 23, and this is so hard to do while you're talking. 21, 20, 19, 18, 17, good, 16, backwards and forwards. This is 13, 12, 11, just try, 10, 9, doesn't have to be perfect, 8, 7, 6, 5, good, 4, 3, 2, and 1, good. Last exercise we're going to do before we do our cool down is a little bit of ab work. So for this is called the double knee raise. Oh, this is fun too. You're going to have your back against the chair and you're going to slide the bum forward. Now, for many of you, you're saying to yourself, I can't even bring up one knee, let alone two. Remember, start from where you are. So the goal is for it to look like this. Give you another side view. And out, right? You can't do that? No problem. Pull the belly in. I'll take that. The purpose of this exercise is to activate the rectus abdominis. Why is this important for balance? Real quick, I'm going to show you. When you step over an object upstairs, you want your default position to be leaning forward. When the rectus abdominis is not strong, remember, your brain wants to make things very easy for you, right? When the rectus abdominis is not strong, your body will tilt your shoulders back. You may have seen this, where if someone needs to bring their knee up, they'll do that. Now, this is very dangerous, right? Why? Because you can fall backwards. The stronger the rectus abdominis is, the brain remembers it can engage it. So instead of leaning back, you lean forward. Why is this important? Because you can self-correct more readily if you stumble. So if you're stepping over a chair and your default is to lean forward, right, you bring that leg over a little bit more carefully. The ability to bring the thigh up to the chest is a function of the rectus abdominis. A lot of people call it core. Core is such a global term. There are many, many muscles involved in the core. So I like to be a little bit more specific. Rectus abdominis, deep core muscles, transverse abdominis, different exercises for that. We'll get to that in another class. All right, I'm going to do one count of 25 here. Remember, do your best. Holding on to the chair. You're going to slide that bum forward to make it a little bit easier. Ready? 25, 24, 23, 22, 21, 20, 19, 18, 17, I see you out there, 16. You don't like this one, do you? 14, 13, 12, good. 11, notice how your legs get involved with this. 9, the hip flexors. 8, 7, good. 6, just do what you can. 5, 4, good, 3, 2, and 1. Let's do some stretching and call it a day on this module. Going to have you stand up in front of your chair. I'll move this out of the way. Going to have the knees and feet apart. Bringing the arms up. Relaxing. Coming down. And just hang there. If you have vertigo, please be cognizant of that. And if you get dizzy, just stop. Coming up. Bringing the arms back. This stretch feels good for a lot of people. Coming down. Good. And back up again. Back down again, last time. Good, now we're going to do a rotational movement with your arms out to the side. Try not to swing your arms, okay? Rotating. Notice how slowly I'm moving, okay? So no swinging. Good. We'll do this 5 more times. Good. Doing great. This is 2. And 1. And I always end all of my classes with the final deep breathing because this next movement exercises your lungs. Deep inhale through the nose, pulling the arms up. Slowly exhale, coming down. Deep inhale. And last time, deep inhale, pulling up. Thanks for joining me for this module. I look forward to seeing you